Are you an X-ray tech or an X-ray student? Have you ever felt rushed, unsure, or nervous before an OR case starts? Do you feel like you're fumbling your way through inputting the patient information into the CRM workstation and the surgeon is patiently waiting on you? Then this video is going to change that. Setting up the CRM workstation in the OR is one of the most overlooked skills, but is the difference between feeling lost and feeling fully in control in the operating room. In this video, I'm going to show you how to correctly put in the information and prepare your workstation before the OR case begins so you can walk into the OR feeling competent and confident. Most mistakes in the OR don't happen during imaging. They happen before the first image is ever taken. Set yourself up before the case starts. The OR is not the place to figure things out as you go. Proper setup means completing all your workstation tasks before the surgeon is ready to begin. Patient information is entered and verified, the correct exam is selected, and the system is ready for imaging. When you do this ahead of time, you reduce pressure during the procedure, you stay focused on positioning and imaging, and you move with confidence instead of reacting to chaos. Preparation creates confidence. What you do before the case determines how smoothly everything else goes. Preparation setup is the process of preparing your CRM system before the procedure begins, starting with entering accurate patient information and ensuring that the system is ready for imaging. When patient data is entered correctly, images are properly labeled, exams are linked to the correct patient, and you avoid delays, confusion, and documentation errors. It also allows you to easily find the patient's information in the workstation in the case the surgeon needs to pull up a previous patient to review or print images. In a fast-paced OR environment, this saves time, it helps prevent stress during the OR case, and it builds trust with your surgical team. In the OR, everything moves quickly, so having this done ahead of time helps you to stay calm, organized, and in control. If you master this step early, you immediately stand out as someone who is prepared, organized, reliable, and ready for the OR. If you only focus on one skill from this video, make it this one. Before the procedure, you'll either manually enter the patient's demographics or select the patient from a work list, which is auto-populated. Whether you're pulling up the patient's information from the work list or manually typing in the patient's information, you must always include the patient's name, their date of birth, and the patient's MRN number or their MRN for accuracy. This is critical because once the case begins, these details are permanently tied to that exam.
Here's a quick demo on how you can pull up the patient's information using the CRM workstation. On the CRM workstation, you'll have two different monitors. You'll have one on the left, one on the right. You'll see the keyboard underneath the two monitors. On the keyboard, you'll see a button that looks similar to this one. It'll say Patient Info. Once you click on that, you'll see this on the right-hand monitor. It'll say New Exam, Scheduled Exam, and usually Update Schedule or Resume Exam. Once you click on New Exam, you'll get to a screen that looks like this. All the boxes turn white, whereas before the boxes are gray. So you'll hit New Exam, the white boxes will come up. You want to manually type in the patient's information or pull it up from a scheduled work list.
Before the OR case starts, I will ask the circulating nurse for a patient label and confirm with him or her that it is the correct patient for that particular OR case. Whether you pull up the patient's information from the scheduled work list or manually type in the patient's information, I will always double check and verify that the correct patient information is correct on the patient label. I'll review and make sure that the patient's name is spelled correctly, that their date of birth is correct, and that the patient's MRN was typed into the workstation correctly. I'll also make sure that the correct exam has the correct anatomical side and that it is ordered correctly.
You're going to click on New Exam. You'll be able to see the boxes that are white. You'll be able to input the patient information, just refer to the patient label, put all of that information, type that in here. All of the information that you typed, you can see here once you manually type that in. You're going to use the patient label, just double check, verify that you have all of that correct information here. Anytime you have the white boxes seen here, you can make changes to any of the information that you put in. However, when the boxes turn gray, you cannot make any edits or any changes to the information here. So in order to fix that, you have to click the edit button when the boxes are gray. That'll turn all of the boxes white with all of the patient information in. If you misspell the patient's last name, you can go in and make the changes once these boxes are white. Hit the exit button.
Systems often allow you to pull from a scheduled work list, which allows you to improve speed and accuracy when available. Just note that if you are pulling it up from the patient information from a scheduled work list, that you must have a reliable Wi-Fi compatible monitor or use an Ethernet cord that attaches from the back of the monitor to an Ethernet outlet in the OR that will send the x-rays from the monitor to the PACS server.
If you want to pull up the patient's name from a scheduled work list, you will hit the Scheduled Exams tab. Then you'll have the option to either pull up the patient's information either by the patient's last name or by the physician. If you click on the Patient tab, this will put all of the patient's names in alphabetical order by their last name with their MRN in this column and the doctor's name in this column in random order. If you pull up the information by the physician's name, that will put all of the patient's last names in random order with their MRN, and then the doctor's name will be seen alphabetically. You can do it either way. Whichever one you decide to choose, you'll simply just click on the one that comes up. So say it's this one here, we'll just click on that. And then all of the patient's information will come up on the next screen. All of this stuff was not typed in because we pulled it up from the scheduled work list. Again, just double check that label, make sure that all of the information is put in here correctly, even though you're pulling it from the scheduled exams list. It can be ordered incorrectly, so if so, again, make sure these boxes are white if you need to make any changes. If the boxes are gray, just simply hit the edit button. That will turn these boxes to white so you can make those changes if you need to. You'll come back to the screen here. All of the information will be seen here, whether we pulled it up from the scheduled exams work list or we manually typed it in. The left-hand side will either be blank or it'll have this black circle here until we take that first image. Hit this Change Profile button. Once you click that, you'll come to a screen that looks like this where you'll have different profile setting options. So you can either choose from general, orthopedic, vascular, cardiac, spine, or bolus chase, depending on which type of exam that you're doing. You're going to want to check the profile setting for that particular OR case. Just know that these profiles are adjusted to make imaging for a particular anatomy better. However, that is subjective depending on the surgeon that you're working for. Meaning if you are doing a ORIF of an ankle, usually you would want to choose the orthopedic setting, but you may be working with a surgeon that actually prefers the spine settings or the general settings instead of the orthopedic settings for that particular case. So it is subjective depending on the surgeon that you are working with. Any of these little bubbles here that you see will allow you to choose which one you're doing. If you do not see a bubble next to it, then that means that that particular C-arm workstation setup that you are using does not have the cardiac setting in this case. That isn't seen on that particular model. Same thing, if you don't have the vascular profile settings set on that, then that basically means you don't have those settings set up to use it for that particular case. So for example, we have a C-arm that we use and it does not have a built-in vascular system. However, we do have one in particular that does. So when we were doing vascular cases, we want to make sure that we have that particular C-arm so that we are able to choose the settings for the vascular cases. Using a particular profile setting will allow factors such as edge enhancement, noise filter, smart metal, and brightness and contrast to be adjusted if need be. So for instance, if you're doing like an orthopedic profile setting, you usually have like higher edge enhancement because you're looking at bony detail, whereas if you're doing a vascular case, that's not really something of interest. So the edge enhancement is either lower or none at all. Once you get out of the screen, you usually see like an exit button down here in the corner. You're going to click on that. This will be your screen on the left-hand side. And this is the left monitor. We will take an x-ray. The patient information is listed here. All of the information that we either pulled up from the scheduled work list or we manually typed in, this information here will be seen next to the patient's x-ray that we take. This is why it's really important to make sure that all of this information is input correctly because that will be linked to all of the images for that patient's case.
Take an extra 10 to 15 seconds to double check that you have the correct patient information, and the correct surgical case ordered for the patient before the case begins. This small habit will prevent major mistakes and help you build confidence fast. How can you build confidence as a student or a new tech? Confidence in the OR comes with experience. For many students, this step can feel intimidating, especially in a high-pressure OR environment. But here's the key. Confidence comes from preparation and repetition and understanding your workflow, not just your technical skill. If your workstation is set up properly before the surgeon arrives, you reduce stress, you avoid mistakes, and you're ready to focus on positioning and imaging. By consistently setting up your workstation early, verifying the correct patient information, and handling any system alerts correctly, you'll start to feel more confident and in control in high-pressure situations. Over time, this leads to better performance, stronger trust from your team, and an overall smoother OR experience. You don't need to be perfect, you just need to be prepared and consistent. That's what builds real confidence. If you take anything away from this video, let it be this. Your success in the OR begins when the first image is taken. Never wait until the case starts to enter the patient information. Do it early, double check it, because once the procedure begins, your attention needs to be on the patient and the surgeon, not on the keyboard. Focus on mastering your workstation setup and you'll quickly become more confident, more efficient, and more trusted in your role. Start applying these steps in your next case and you'll feel the difference immediately. Let me know in the comments what you found to be the most helpful tip from this video. If this video helped you learn how to confidently and competently set up your patient information into the OR CRM workstation, then like and subscribe for easy to follow X-ray tips and real image critique. Master X-rays one at a time. Subscribe for weekly positioning tips. See you in the next video.